A very good afternoon to you, and thank you for staying with us. This is the news feed on Newzroom Africa, channel 405. A story that I spoke to you about a little bit later on concerning the Traditional Healers Organization of South Africa. They have urged traditional health practitioners to refrain from claiming to have powers to treat or cure the coronavirus. The association says traditional health practitioners are able to treat as well as manage colds and flu. They're able to treat coughs as well as other related symptoms, but they cannot treat the virus. For more on this, I'm joined on the line by Ugogo Pepsile Masego, a traditional healer and national coordinator of the Traditional Healers Organization of South Africa. A very good afternoon to you, and thank you for your time today, ma'am. Won't you give us a bit of background as to what it is that incited the organization to come out and make a statement regarding this?
Thokoza Tani, and good day to the listeners. One thing that made us talk to our members was because we had realized that after we had a very good meeting with as traditional health practitioners and organizations with Minister of Health, Dr. Mkhize, we agreed that we were going to continue to support the efforts of government to flatten the curve on COVID-19, and also that we felt it was our responsibility as a professional organization to encourage members, to start to begin efforts to prevent COVID-19, and also to give basic information on signs and symptoms. But more than that was that when we realized that a lot of our members were now coming out and saying we can provide solutions, then we said, no, let's request that all members refrain from providing solutions on media and everywhere else publicly. But instead, let us rather talk to the Minister of Health, Dr. Mkhize, to request for funding support for a research program which will involve not just Health Department, but also the Department of Science and Innovation, wherein both the departments and probably other departments would join in and support efforts to provide an African solution to the COVID-19 epidemic. Then we're able to speak to the Department of Science and Innovation, the IKS unit there, and said to them, could they please assist us identify universities that could work with us and ensure that we provide an alternative solution to the epidemic, to the coronavirus.
One thing that has really been coming out is the fact of the differences that exist between the flu virus and the COVID-19 virus. As far as the Traditional Healers Association, are the resources available to allow you to be able to use traditional medicine to be able to come out with possible solutions and possible treatment for viruses such as the COVID-19 and any other that might come up in the future?
We are very much aware, Tammy, of the sensitivity here. We are very much aware also that of the fact that COVID-19 is a new epidemic, and there's quite a lot of things that we also are learning as practitioners. And that is why we said to our members they should refrain from claiming anything now. Let's rather give research, the responsibility to investigate what our medicines can do behind doors, and once they've investigated and found anything that is breakthrough that could be shared with the world in South Africa in particular, we then can be able to communicate the findings from that. But we said, because we do not have money, let us rather request government departments such as Department of Health and the Department of Science and Innovation to work together to fund this particular initiative, because we cannot say to healers they should not claim, and the next thing we don't do anything about it, and also that government is not seen to be supporting alternative initiatives, but only wanting to focus on Western solutions to this problem in Africa. So that is why we said, Minister, in order for you to help us quiet these healers, provide funding support to the research initiative, which I think Minister of Health and also the Minister of Science and Innovation, Dr. Nzimande, are working together, to support an initiative like this one. But the one thing that I can tell South Africa and the world is that already the University of the Free State has been identified to host this project. The University of KwaZulu-Natal, Durban TUT is involved. University of Pretoria is involved. This also is one of the institutions that we're looking at to participate in this program. So we've tried to put together a number of science councils to work with us to ensure that this happens. But more than anything else, we said because we have realized the economic impact of this virus to communities, we said we'd like, once we have a breakthrough, we've made a breakthrough, we want the medicines that would have been discovered to work, to then be planted in rural communities as part of rural development. And that's when rural development, agriculture, and all the social development would have to participate and fund rural communities that are going to be involved in the cultivation and conservation of these medicinal plants.
Oh, we thank you so much for your time and for that update this afternoon. That's uGogo Pepsile Maseko from the Traditional Healers Organization of South Africa.